Hello everyone, I'm Charlotte Kilpatrick, reporting for Vaccination at the World Vaccine Congress in Washington. I'm delighted that today we're joined by Emily Tiemann of Economist Impact. Thank you for joining us today.
Thank you for having me.
So to kick us off, would you just introduce yourself and the role you play within your organization?
Sure. So, as you said, my name is Emily Tiemann. I'm a manager in the health practice of Economist Impact within the Policy and Insights team. So what we do, we are the research arm of the Economist Group, so that includes the magazine, the Economist Intelligence Unit, but we focus more on client-sponsored work, really trying to dig into key issues that our clients and partners are facing in their industries, and really producing engaging content that can be amplified to a global audience in a really efficient way through different forums like white papers, events, infographics, videos, just any kind of as engaging as we can make it so that it reaches that really influential global audience to really try to drive change.
Fantastic, that's great to hear. So as part of your work with Economist Impact, you've been exploring cervical cancer and the HPV vaccine. What are some of the key concerns that you have here?
Yeah, so cervical cancer is an interesting disease. It's globally the fourth most high burden cancer for women globally, and the impact and the burden has been increasing a lot over the past few years. And what's quite unique about cervical cancer is that it is preventable, and that's because of the HPV vaccine, which has been around for a few years now. But despite the existence of the vaccine, there is a lot of concern about access, so especially about the income level of countries. So higher income level countries usually have organized vaccination campaigns. I think about 90% of them have organized programs for girls, and about half of them have gender-neutral vaccination campaigns. But lower income countries, the access is a lot lower. So about half of them have programs for girls, and only about 5 of them have gender-neutral programs. So actually globally, only about 13 to 15% of eligible girls have been vaccinated with the HPV vaccine, which is quite low. And it's quite a good time to be talking about all of this. In 2020, the WHO released its global targets for cervical cancer elimination, and they have certain targets and aims that countries should be meeting by the year 2030 if we want to eliminate cervical cancer by the end of the century. And one of those is related to vaccination. So the aim is that 90% of the eligible population, so girls, should be vaccinated with HPV. So right now, as I said, we're only at about 15%, so there's a lot of work to do to reach those targets. The other important aspect of cervical cancer is screening. So early diagnosis is really key to better health outcomes, better outcomes. Again, there's a lot of access issues in terms of income levels of countries, and actually more than 90%, I think it's 94% of cervical cancer deaths occur in lower and middle income countries. And it's mostly the countries that have better health system infrastructure that are able to offer programs for screening. And the WHO, they encourage countries to have these organized programs and population-based with the target age range for women. The targets are by 2030, 70% of women should be screened with a high-performing test. And right now, again, we're not really at those levels, so there is work to do to be able to reach those targets. And if we can eliminate cervical cancer, that's really the goal here.
Absolutely. So you've mentioned some of the distinctions between higher income and lower income countries. Can you explore the barriers to coverage that might be faced in some of these areas?
Yeah. So through our research, we found that the main barriers are around cost. So obviously there is a cost to everything, not just the vaccine itself, but also having the infrastructure in place to be able to deliver that. So having the health force, having the political will as well, just to be able to see this as a priority and put the necessary resources into being able to have those programs and effectively deliver the vaccine. Another big gap is awareness. So, and that can also be stigma. So there's some maybe cultures that associate the HPV vaccine with sexually transmitted diseases, for instance, and mothers may think that their girls don't need this vaccine, but really we need to communicate better. We need to raise that awareness to show that the benefits and not just what people think the HPV vaccine is, but really communicate that better, raise the awareness. And there's many ways that can be done through different campaigns, really reaching the community where they are, different ways to communicate culturally or based on where they live. I think there's a lot that can be done just to encourage people to go get vaccinated, because even when the programs exist, maybe they're not actually being used by the population. Some of the higher income countries who do have those efficient programs in place, a lot of them are school-based, for instance, and that works well because then it's much easier for the girls to be able to access. So that's one thing that countries are doing. But again, we need to be able to communicate that to raise the awareness of those programs so that we can reach the population more efficiently.
Absolutely. So you've emphasized the importance of communication here in order to raise awareness, encourage people, and sort of put their minds at ease. That takes me on to my next question about what Economist Impact is doing. Can you tell us a bit about any campaigns or resources that you're creating?
Yeah, so we've been partnering a lot with our clients. So for instance, Roche, MSD work a lot in this space, and we've been helping them to really raise awareness about these issues and suggest a way forward. So for instance, we've been looking a lot in the Asia Pacific region. So we recently released a report all about the need for investment in women's cancers, and that included in large part cervical cancer. And we looked at emerging countries, so countries that are really growing very quickly and whose economies are growing quickly. So that included Indonesia, the Philippines, Malaysia, Thailand, Vietnam, and India. And we suggested some regional calls to action, but then also country level focused recommendations of what they can do to try to meet the challenges of cervical cancer, to get the investment and to raise vaccination rates, to raise screening rates, really ultimately to try and improve outcomes in their countries. Some of what we recommended include, I mentioned political will and leadership, really collaborating with patient advocates, with different professional organizations, with healthcare professionals, really to come up with a collaborative message. Implementing and updating elimination plans and strategies. So that's something that has been recommended that countries do this internally, and most of them have not. Some countries are implementing strategies. We have to have clear goals, clear aims for reducing cervical cancer to have elimination, but that's still very much in the works in a lot of countries. Also the importance to have better performance tracking through registries. That's something that is still lacking in many countries, and it's only if we have the real-time data that we're able to suggest a way forward and using that data to be able to make efficient policies. Another thing is, again, national HPV immunization programs. Many of these countries don't have that in place yet, or they're not able to reach their population very efficiently. And then organize population-based screening in line with HPV, with WHO recommendations. So high-performing tests, women aged around 35 years old, really getting those organized so that women are invited to screen instead of having to go and ask their doctors to be screened. So really going from top down. And then the last thing is for them to be very patient-centric and really adapted to the community. Not everybody is going to go and travel long distances, so we have to think about what else we can do. For instance, some countries are implementing at-home testing, like self-testing for cervical cancer. And if you're living in a rural community where you're far away from the nearest health center, that can be a way to bridge those gaps and to give access to those women. So that was more in the emerging countries. We've also done some work in Europe. So many countries there, we can look at them as kind of good services, good systems. One of the countries that has done very well is Sweden. So we looked at them as a case study that other countries can look to try and kind of not replicate, but learn from some of the challenge that they went through, how they found solutions, and potentially look to use some of those lessons in their own countries. And we've also looked at what other countries are doing well. Another example is Rwanda, so a low-income country in Africa but has extremely high vaccination rates. So what are they doing differently? It's good to be able to learn from these countries and use them as case studies. Australia also, very, very good, good progress there. Sweden and Australia are on track to eliminate cervical cancer by 2030, which is very exciting. So by looking at what these countries are doing well, what we did is we produced a 10-point plan for cervical cancer elimination using lessons from these countries that are doing well. And we've recently released that a few months ago, made that publicly available, and it's being used by a lot of countries right now to help them put together their strategies and national plans for elimination.
Fantastic. That sounds like, well, that was a very thorough summary, and we will include a link to that in our article so people can go and find it. My final question is, it's great to have you at the Congress, obviously, and with your team. What have you looked forward to, and what have you taken away from your time here?
It's always so inspiring to attend events like this. I mean, obviously everybody here is top of their field, really knowledgeable, and have a lot to share. So I feel very honored to be part of that, to be able to hear from all those very smart, very, very, very important people who really are able to drive change. So I've really enjoyed all the conversations I've had, not just to spread the message that we've been doing, but also learning about what they've been doing. Really enjoying the collaboration, just talking and sharing ideas, I think is key. There have been a lot of sessions that I particularly enjoyed about access and awareness, because it's not just getting vaccines made, production and all of that. There's a lot that goes into that, but once we have the vaccine, again, we have to make sure it's getting to the right people, and I think that is key, and that's something that's missing a little bit on a global level. So I've really enjoyed being able to be part of those discussions and how to really raise awareness and make sure that we get those vaccines to the right populations.
Great. Well, we hope the rest of your time here is productive. Thank you for your time.
Thank you so much.